what was a test that you couldn't really see any problems, but she felt the problem?
Diagonal.
Yeah.
Diagonal.
Toward the left.
Yep.
And then this one you felt was dizzy.
Oh yeah, and then I felt dizzy within like 10
Yeah, so that's an obvious one, right? Just like, no, I don't like that. But if you're unsure, yeah.
Yeah.
What's something else that we could do? And Dustin had a very subtle feeling when he was doing the VORs. He felt like the pen was skipping. He's like, not that I couldn't focus, it wasn't making him tired, but he felt like the pen was moving around. So that reporting, you know, it's more subtle, and you can't really see his eyes. It's probably one of those tests or one of those scenarios where having the goggles would probably be helpful, but we don't have those. What's something we can do to look at surround inhibition? Don't say it because you guys already know. What's another quick test that we could use to check for surround inhibition in the system? Quick little manual test. Okay, so give me your arm. Push up. Good. Do your thing. Do the thing. Yeah, do the one you don't like.
Just eyes.
Just eyes.
I'm like, what am I doing?
So we create that uncomfortable sensation. The nervous system becomes a little disorganized. And then push up in my hand. Right? So we can do that systemic muscle testing to look and see, yep, that created surround inhibition. Okay? And then if we apply some inputs, all right, we're going to do some rolling patterns to the left for Jen because her VOR cancellations that way, some visual stuff, and all of a sudden, it comes back on and you got less symptoms. So if you're not certain, there's no harm in doing a quick systemic muscle test to see if there's surround inhibition. Okay? And you can use any muscle. You can use lat, shoulder, whatever. Okay? So it's just another thing to confirm. Cool. Let's go to cranial nerve. I'm going to keep you up here. So we'll do cranial nerve touch testing. So we're just looking at connectivity testing. We're not going to look at function today. And then we'll go into the canal testing for connectivity. And then after that, then we're going to look at the mechanical components of the canals using using a Dix-Hallpike, and then Epley maneuvers, as well as a few other ones to correct. So let's do cranial nerves. So cranial nerves, when we're doing the touch testing, even when we're doing the functional testing, it's very low input. So we're not stressing too many more things outside of those cranial nerves. So I would put these ahead of vestibular testing because, again, once we start spinning around those inner ears and we start spinning people out, we're going to set off the whole system. So in the order of what do we want to stimulate, cranial nerves, I would put before vestibular. Okay. So for cranial nerves, what's cranial nerve 1? I'll pop this off.
Oh, great. So I was wearing it.
Yes, I know. Cranial nerve 1? Olfactory. Okay. So we'll get a baseline. We'll use systemic muscle testing here. Push up. Good. We're just going to pinch, bridge of the nose, and we're good. Okay. You had that one gentleman with an olfactory nerve issue, and that came on before a lot of his other cerebellar and balance and all kinds of other things. But he reported that he lost his sense of smell prior to all of these movement problems. So we did the test, and it just shut right down. And then he brought up, I lost my smell before all of this balance issues and all these weird things were going on with my body. No, but cranial nerves, because they're so sensitive and they're around the brainstem, they'll take priority just from a survival perspective, right? So all of a sudden, some of those more sensitive, primitive structures are now being affected, right? What's number 2? Optic. Okay, whose phone is that? Can I borrow that? I just need a torch. Oh, I just need a flashlight. Cool. Okay, so we set our baseline. Boop. Okay, just a torch, flashlight in the visual field to see. Yep, we're good. What's number 3? Ocular motor.
Oh my God.
Oh my God, what is this? Ocular motor, okay. So cranial nerve 3, ocular motor, what functions of the eyeballs, what functions of the eyes does it primarily control? Convergence, okay. So, and it's also it's got a parasympathetic ganglion on it as well. So close the eyes, okay. We're just going to touch the inner canthus of the eyes. Test, push. Good. 4. Trochlear, yep. Yep. So look up. So 3, 4. So the superior rectus muscles. 5 is trigeminal. So we just swipe the 3 zones. Push up. Good. 6. Abducens. So they abduct the eyes. So they're out here, outer canthus. And we push. Nice. 7. Facial nerve. Good. 8. Vestibulocochlear. So we're just going to fingers in the ears, stimulate, fire off, and then the other component to that is the tectum. So we cup and push. Good. 9. Glossopharyngeal. So we just come into the lateropterygoids. There. 10. Vagus comes out behind the mastoid process in the dimples here. Okay, right in the occiput. And we push. Good. 11. Spinal accessory, traps. Push. And 12. Hypoglossal, tongue, right? So swiping here. Good. Okay. If there's an issue or a conduction issue with any of those cranial nerves, again, we'll get that surround inhibition. So we got to figure out what do we need to do from an input perspective to get them to start firing up. Do we need to do some touching, some whatever the motor control, if it's motor or is it a sensory, or is it both? Apply the inputs. Tapping around typically will help clean up some of that bioelectrical problem. Cool? And then for the canals, okay, so always set your baseline. And if you're not sure if it's going to work on them, you can always do the ballerina test. Does everyone remember the ballerina test? No? So this is where we can use truths and lies. If something is truthful, nervous system says, yep, I like that, I agree, feels safe. If it doesn't like it, nope, that's a lie, it doesn't feel safe, I'm going to create some surround inhibition. So let's start with the truth. Jen, say your name. Jen.
My full name?
My name is Jen.
My name is Jen.
Push. So that's the truth. Say I'm a ballerina.
I'm a ballerina.
And say I'm a ballerina.
I'm a ballerina.
Come on. Believe it.
I'm a ballerina.
No, you're not. Okay. So using a false statement creates that insecurity, that feeling of unsafe, and just nervous system's like, nope, I don't like that. Okay. So, and it gets the client to be like, oh, I see a difference, right? Unless they're a ballerina, then use something else. For the canals, we're not going to flick into the direction that the canal works, because if somebody has poor range of motion in the neck, we don't want to be jamming them up. So we're going to start in the position opposite, and we're going to flick back to center, okay? Because we need to add a little bit of velocity. So if we're going to go after the right, and I'm just going to use this for just visual teaching. If we're going after the right anterior canal, we're going to go back, rotate left, and extend left, and we're going to flick back to center. So the direction of force is back towards that canal. Push up, and that one's fine. Left anterior, we're going to go back, rotate away, and flick. And we test. If we're going into posterior canal, we're going to go forward, rotate towards, and up. So we go right posterior canal, down, left posterior canal, boop, push, and something is there. So we have a left posterior canal problem on the left. And then horizontal, so left horizontal canal, push, that one's fine. And push, and that one's fine. So we found on Jen a left posterior canal disconnection, okay? So again, we're stacking a lot of these findings to see, okay, Jen didn't like VOR cancellations to the left, she didn't like spinning, and you didn't like that one, okay? So right cerebellum on that side, but we may have some canal issues, because if we're spinning to the left and the eyes are going left, and we have a posterior canal issue, again, we might need to do some rocking, rolling towards that side with some visual drills. Okay, so let's go through those real quick, and then we'll get into the mechanical vestibular, and then Brucey will get into some of the correctives, and then we'll go into some manual stuff at the end. Super? All right.